Hello, thank you so much for coming. Sorry for the radio silence. I was being nudged and I hadn't noticed it. Thank you for coming this evening. This is going to be an incredibly important talk about the NHS bill, commonly known as the Corporate Takeover Bill. And much of the discussion is going to focus around how we can push it back. We've already seen not just a creeping privatisation of our NHS, but almost a wholesale attempt to privatise it. Up to 11% of our NHS contracts are already going to private companies. And although the claim is that this bill will undo some of the worst of Andrew Lansley's 2012 bill, that saw competition enter the market in a way that it hadn't before. Many of us aren't confident that that's actually the case. And we've seen the fallout from Owen Paterson and the dodgy deals that were done then. But potentially, if this bill goes through, Owen Paterson could look like a drop in the ocean, and we could see deals going to private sector companies in an underhand, surreptitious way with a lack of transparency like we've never experienced before. And it is down to people like you and I, like People Before Profit, who have organised this event today, to do all we can to make sure that that is not the case, that the NHS stays free and publicly run and publicly owned, as opposed to being publicly funded private company takeover. So we've got 5 excellent speakers this evening. Some of you will have heard Jonbosco Nwogbo before from We Own It. He was an incredible speaker at one of the recent NHS meetings that I attended, talking about alternative providers who can tender for contracts in healthcare. We've also got Polly Smith, who's a long-standing and experienced care worker and also a Unison member. So Polly's got a wealth of experience in care. Mark Harrison for the Norfolk DPAC group, who's done an incredible amount of work supporting disabled people in our area. We've got Christopher, who is substituting for Jan Short from the National Pensioners Convention. And we've got, hopefully, Colenzo Jarrett-Thorpe from Unite National Health Committee. All these people are going to be able to provide a variety of different experiences and opinions about how this NHS bill could impact on all of us. Wendy's put some information in the chat about East Anglia People Before Profit and when it started up. And so if you want any more information about it, then the email is in the chat. So please do get in touch, because obviously the more members we have in People Before Profit, the stronger our voice can be and the more we can help push back. So I am pleased to go over. Each speaker will have about 10 minutes, and there will be a question and answer facility at the end for those people that have managed to stay. And so we're going over to Jonbosco, who's going to speak from We Own It. Thank you and welcome, Jonbosco.
Thank you so much, Joe, and thank you so much to People Before Profit for inviting me to be a part of this discussion. When I got the invitation for this, I had been under the impression that the health and care bill, which we had known for some time, was going to be getting a vote in the House of Commons today. We were under the impression that the vote would be happening around 2 p.m. or so. But as I speak to you right now, the debate in the House of Commons is still happening. I anticipate that it will be happening into the night, and I'm keeping one eye on it. So I hope people will not mind terribly if I have to disappear at some point, because I need to send out a bunch of press releases to the press as soon as it happens, so that we kind of get our voice into all of the coverage that will be happening around the result of the vote when it happens. And of course, there are other things that we need to do to react to the vote as soon as it happens. Of course, we are anticipating that the bill will pass, and I'm going to talk to you a little bit more about our plan for kind of going forward and still winning this fight in some ways. But before I go ahead, so the bulk of my remarks this evening will be about the NHS bill, about what it does and how we can fight it. But before I go any further, I have this introductory ceremony I do where I talk a little bit about We Own It. I suspect that some of you already know who We Own It are, but for those who don't, we are a campaigning organization that campaigns against the privatization of all public services. So we believe that public services should be run for people and not profit. We try to be a voice for public service users, and we've been running campaigns more recently, for example, around public ownership of our water. You will of course remember that recently the government voted to allow sewage to be poured into our rivers. We are currently campaigning against the privatization attempt of Channel 4. Recently we understand, of course, that the government is putting back their plans to privatize Channel 4. But we think that's quite temporary. So we are keeping an eye on that, and we're going to be continuing to keep up the pressure on them to prevent that privatization from happening. And we're campaigning against privatization in rail, in buses, and a bunch of other areas that I don't want to go into this evening, because we're here to talk about the health and care bill. So as you know, the government has put forward its plans to reorganize the NHS, or as one writer called it, to re-disorganize the NHS. Right now, the NHS is made up of around 147 clinical commissioning groups, essentially those small bodies that whose jobs is to commission service. So to find out exactly what the needs of a local community are and commission service for those communities. Those organizations will be scrapped by this bill, and it will create what it calls an integrated care system. Integrated care systems are almost exactly the same things as ICSs, as CCGs, or clinical commissioning groups, except in a few respects. Of course, they're much larger than CCGs. I think the average ICS will be responsible for the health and care needs of about 2 million people. Yes, and they have their own budget, and their job is to make decisions about how to deliver the health and care needs of the people in their area based on those budgets. And they're, of course, they're not allowed, they cannot run over their budget. And there is the possibility that if that we're going to see ICSs have to make decisions about cutting services because it is not within their budget to provide the full spectrum of the health and care needs of the people in their area. So we are, and of course, each ICS will have a board that will oversee the job of those of that ICS. There are four things I think that, from our point of view, from the point of view of people that are opposed to privatization, who believe that public services should be run for people and not for profit, there are four things that this bill does that we are very opposed to. Of course, there are a bunch of other things that it does. It's bad on so many levels, but from my point of view, we're really concerned with the fact that the bill will allow private companies or individuals who work for private companies to sit on these ICS boards. As Joe said at the beginning, the bill essentially allows for the possibility of somebody who works for a private company to also have a second job, essentially working for an ICS board. And it's pretty much exactly the situation with Owen Paterson, where he had one job, that is as a member of parliament, and another job as a consultant for Randox. And he used his influence in one job to get contracts for the people in his second job. And it's pretty much the same situation. If you have a Virgin, for example, in Bath, they had a director of Virgin sitting on the ICS, the kind of the precursor organization to the ICS board there. And we very much run the risk of people using their position in ICS boards to influence decisions that then help the companies they work for get contracts. And even worse, those companies could get those contracts, do a terrible job at those contracts, and who is going to hold those companies responsible? The very same committee or very same board that those people are members of. That makes zero sense. We managed to put a great deal of pressure on the government. We got about 11,000 people to send emails to the Public Bills Committee earlier this a few months ago, and we saw the government offer concessions on this specific issue. They said we're going to put forward an amendment. They have put forward and passed an amendment that I think is not worth the paper it's written on, really. It's an amendment that essentially leaves it to the chair of the ICS boards to make a decision as to whether or not they think that a prospective appointee to the board has interest in private healthcare that could undermine the independence of the NHS. I mean, of course, you can already see what's wrong with that. Number one is that the ICS boards are going to be recommended, ICS board chairs are going to be recommended by NHS England, but they will be approved by the Secretary of State. So of course, the chair of the ICS board is very much susceptible to the agenda that is set for them by the government. So that's one of the things that we have a serious problem with. There's also, of course, the second issue of the possibility of ICS boards being able to delegate their duties to what's called provider collaboratives, essentially a group of providers, including private companies, being able to make decisions, commissioning decisions as a group. And of course, there is that risk of private companies being part of these collaboratives who make those kinds of decisions. And we asked the government, we actually put a great deal of pressure on Labour to put forward an amendment that would prevent this. And they did so. They put forward an amendment that prevented private companies from sitting on any decision-making body. So if anybody is making a decision, private companies should not be able to sit on those boards. The third thing, of course, that the bill would do is it makes it possible to give out contracts to private companies without scrutiny. Of course, we are. It's a good thing that the government is aiming to repeal Section 75 of the 2012 Health and Social Care Act. It's a section essentially that mandates that all contracts for services in the NHS should be put out to tender. So they're repealing it, which is a good thing, but without replacing it, what they are creating is a situation where contracts can basically just be handed out to private companies without any tendering process, without any transparency, and without any scrutiny. And we have asked for them to replace it with an amendment that makes the NHS a default provider of NHS care. And finally, there is the possibility that APMS contracts, the kind of contracts that allow for private corporations like Centene to take over our GP contract, GP practices, will be allowed to continue. So finally, what can we do? And just to touch a little bit on the amendments that have been put forward to mitigate these problems, the government has voted against every single one of them. So we have a sense, of course, that they are going to vote to pass the bill later tonight. But there are things that we can do. The bill will go to the House of Lords after tonight, and the House of Lords, the government is outnumbered in the House of Lords. So we can put pressure on peers in the House of Lords to pass those amendments. We know, of course, that the government can reject those amendments when the bill comes back to the Commons. But what normally happens is that the government is forced to respond with a kind of compromise amendment. So we would have, at the very least, scraped something from them at the end of this fight. So that's one way that we can go. But I think that the main center of this fight is going to be outside of Parliament. We're going to have to fight at each of the 42 ICSs individually to prevent private companies from being allowed to sit on those boards. We have engaged with the Bath ICS and put pressure on them, and they have told us that they do not plan on kind of allowing Virgin to be a part of the ICS, but we do have to keep pressure on them. We have to keep pressure on all 42 of them. Yeah, I'm going to stop there. And thank you so much for having us. And I think what I would like everyone to take from my remarks really is that the fight doesn't end today with the bill passing. The fight does not end when we get the House of Lords to pass the amendments that we want. The fight will have to continue in each of our communities, where we we make sure that our local ICSs do not allow private companies to sit on those boards. Thank you so much.
Thank you, Jonbosco. As ever, such an informative contribution, and I really am sorry that I had to cut you off a bit. I'm hoping that you'll still be able to stay around. I appreciate that you've got to keep an eye on the news that's coming out, but if you could stay around, I know that people will absolutely value being able to have a greater discussion for you. What Jonbosco has actually highlighted is the huge gaps in accountability and decision making on care. And in matter of fact, while private companies can have a seat on the board of an ICS, multiple local authorities will have to share one seat on a local board. So people like me, an elected borough councillor, not that I would be allowed to sit on the board anyway, because I'm not a Conservative Party member, and they do like to share out the places on boards themselves, but it still does go to show there's going to be a lack of accountability by those people that are actually elected into positions. So I'm now going to hand over to Polly Smith, as I said previously, an experienced and long-standing care worker, and also a Unison member, and still sitting on the NEC, I believe. Thank you, Polly.
Thank you, Jo. Yes, I'm not going to speak as long as the previous speaker. I'm not going to repeat all the information he gave, so there'll be more time for questions and answers. I am Polly Smith, a care worker on 0 hours, and I'm low paid. I was working throughout this pandemic, excluding the 4 months I was off with COVID and long COVID. I did that with no sick pay. On the flyer publicising this meeting, I am described as a care worker and a Unison member. So I think I had better get that Unison bit out of the way first. There are some Unison members, rather misguided members, who are supporting the government's health and social care bill. I do not at all, and I do not understand why they support this, but hopefully they will change their minds. They need to. In fact, I'm at a meeting today in Birmingham, local government SGE, and we'll be discussing that. Anyway, excuse me. This is a dangerous bill, and under it, terms, conditions, and low pay will only worsen, while allowing more privatisation and less accountability. Oh, this Oh, I'm doing quite Johnson here. As I said, there'll be less credibility. Excuse me. After the offence of last night in Parliament, I've had to rewrite parts of my speech. Because of it, we need to look at all the government's actions and amendments. It's not just straightforward. As you know, last week they introduced a new amendment. Yes, there is a crisis facing health and social care in this country. It is a crisis the government's making, who, like Nero, fiddled while Rome was burning. There is massive underfunding, staff shortages, and low pay. The government could choose to address this, but they do not. Rather, they prefer to give out handouts to their Tory voters, friends, and their sponsors. This crisis can only be truly met by providing better terms and conditions and pay. But this bill does not do this by any way. We must look at the government's most recent amendment, which they proposed last week. That's the 86,000 cap, which only benefits the wealthy, while forcing others to sell off their homes which they've lived on for the main part of their lives. And as a care worker, I go into people's homes and they said they were born in their homes or they're born in that street, only moved when they married. They'll be forced to sell their home. And people in residential homes, I mean, the profiteers are just making money out of them, thousands of pounds a week, and they can't even get a cheese sandwich. Anyway, apart from that. This bill can be defeated by strong fighting unions. Look what occurred over the weekend when midwives were organised and rallies to protest against the damaging staff shortages. I'm family because I got a broken arm. If the Tories really cared about care, they could address the issue of low pay. We can afford better conditions as we are one of the richest countries in the world. We will soon be moving to American standards, where over 500,000 people each year are facing bankruptcy due to having to pay medical or care bills. We don't want this to happen in this country. By allowing more private companies to become involved with the NHS structures, the Tories are looking after their friends' interests. We don't need an increase in national insurance to fund health services. What we should have to do is to make the rich pay more tax. The bill is like the COVID PBP scandal, when contracts were awarded to inexperienced Tory friends. A few days ago, I would have said Boris Johnson was unbeatable in Parliament. But last night, all that changed. Results produced rebels, Tory rebels who, while they opposed the bill, part of that amendment, they did so not because of genuine concern, but they did it to protect their seats when they're going for re-election. They don't really care about it. They say they do, but they don't. But like John was saying, there is still time to increase the Tory rebel numbers. And if Labour becomes a real opposition, this bill may be defeated. But only if we have a truly independent media. For example, the Tory BBC claims the recent cap will be okay because it will only be in effect for the next 3 years. It won't come into effect for 3 years. So what we need to do, apart from campaigning, we need a real fighting unions. We need a strong opposition, not a weak one, that we've got at the moment. And we need a truly independent media. At the moment, all we are hearing is Tory lies. We need independent media. Thank you.
Thank you, Polly. And I think we need to remember that this government, through care home workers, not just to the walls, but for some of them to the graves, as well as healthcare staff. These are staff, Polly said she's worked throughout the pandemic on minimum low pay and no sick pay or statutory minimum when she was off sick. And that is despicable treatment of people that we are calling on to look after our most ill and elderly, frail people. And the NHS has been the same. I know in my local hospital, NHS workers were told not to wear masks because it would frighten the patients. Now, you know, it's sad if patients can't tell that they've got a hard-working, well-trained professional looking after them just because they're wearing a mask. But we know that to be true. And as Polly said, this government could, in matter of fact, use this bill to address low pay and staffing shortages, but it's not. And this bill actually could make it easier for the NHS to move away from nationally agreed terms and conditions under Agenda for Change and towards local terms and conditions. And that is a very, very scary proposition. Polly's right, we need fighting trade unions. Our next speaker is Mark Harrison, who has been fighting for years under the auspices of Disabled People Against the Cuts. And I've joined him several times in Norwich for campaigns, and it's good to be able to introduce you here. So thank you, Mark.
Thank you, Jo. So tonight I'm going to be speaking about the social care crisis. And essentially what I'm going to be saying is that social care is broken beyond repair and needs to be scrapped and replaced with a legal right to independent living, supported by a national independent living support service that is based in the public sector, paid for out of general taxation, free at the point of need and use, and delivered in co-production with disabled people through peer-led disabled people's organisations, co-ops and not-for-profit organisations, and that the staff need to be paid on national terms and conditions with proper training, etc. But we're a million miles away from that, not just with the Tory party, but with the Labour Party as well, because while we expect this from the Tories and it's devious and nasty, what we know is that the Labour Party is in it up to its neck, that they are supporting the new systems that are being set up and are involved in it at local level before the legislation has even been passed in Parliament. And in Norfolk, we have the joy of a former care minister in a previous Labour government being the head of the new integrated system. And she was the person who left the Labour government to join Bupa to privatise the NHS way back in the 90s. So we know it, and they've got form. But so my warning, I suppose, about this is that social care is the vision of the NHS future. You know, the Tories have used social care as the test ground for privatisation. 30 years ago, 90% of social care was in the public sector. Now, today, 90% of social care is in the private sector. That's why it's a test bed for the Tories' privatisation. You can see the vision of your future in social care. And of course, the only part of the system that isn't in the private sector is the assessment and care management part. That's the bit where local authorities ration services, manage need, and then they have the audacity to charge disabled people for services that are inadequate and failing. And since the Care Act was introduced, they have the legal right, and up and down the country, Tory and Labour authorities are robbing disabled people, taxing them money out of not just their earnings, but out of their benefits to pay for this inadequate social care system. So you can see really the vision of your future unfolding through social care. And let's be clear about it. Social care is the only people who get social care are disabled people. Disabled people, you don't get social care because you're an old person. You get social care because you're a disabled older person. Now, 50% of people who get social care are children or working age adults. That's what 50% of the budget goes there. But if you listen to this government and the policies that are coming out, you'd believe that it was only older people that they're concerned about, which of course they are, because what they're concerned about is Tory voters in the home counties. And that's what we saw playing out in Parliament last night. The problem is that Labour aren't any different, because Labour support the charging of social care. They support the taxation of social care. So when the comments last night from shadow ministers, it wasn't them committing themselves to saying, right, we're going to scrap social care charging, we're going to make it free at the point of need using the model of the NHS alongside the NHS, paid for out of progressive taxation. In fact, what they said was, we would be fairer in our charging. We wouldn't take as much money as the Tories from working people. And of course, that's what the government have done, that they announced the huge tax rises out of regressive national insurance to pay for social care. But of course, it's a plan that has nothing to do with social care. The first 2 years of the tax rises are going into subsidising the NHS. They aren't going into local authorities, but to pay for social care. So there's a double whammy, because the rises in local authority council tax bills to pay for social care will be on top of the national insurance rises that people are going to have to pay accordingly. And when, as I say, when it does eventually kick in 2023, it's about saving Tory voters in the home counties who, you know, and it's been repeated on television a lot, but, you know, just to be clear, this cap of 86,000, if you've got a house worth 100,000 or a house worth £1 million, you will pay the same amount. So that means that people with assets of around £100,000 will pay the vast majority of that and be left with nothing. Whereas if you've got £1 million, you will only pay 86,000. So it's very clear just what the exact nature of this is. But let's also be clear that Labour don't have a different policy. They agree with Deal Not. They agree that people should have to pay for social care as and when they need it out of their personal wealth. And so there's a big job to do. You know, we applaud Andy Burnham, the Mayor of Manchester, who seems to have had a road to Damascus since he was a care minister in the Blair government, has come out very forcibly and said that social care should be free at the point of need and use, paid for out of progressive taxation along the lines of the NHS. So that's to be welcomed. But you know, everything's back to front. So they announced the taxes to pay for social care, but they haven't come up with a plan. Yesterday, they said, we've got an equality impact assessment, but we're not going to release it. We're not going to tell you what that equality impact assessment says ahead of the vote in Parliament. And of course, there is no plan for social care because they haven't finished it yet. There hasn't been the promised government legislation, draft legislation green paper, white paper, whatever they're going to do. Nobody knows because they're still planning it and still discussing it. So it's all the wrong way round. So I suppose my take is that obviously we have to oppose what the Tories are doing. That goes without saying. But my fear is that the Labour Party are so steeped in this, and I don't know where the trade unions are, because there's a lot of support within the trade union movement for a national independent living support service or a national care service paid for out of direct taxation, progressive taxation, free at the point of need. But what's going to win out? And I suppose that's our job, is to, and that's what DPAC have been doing. So DPAC have gone back on the streets, as you probably saw recently, and brought London to a standstill again. It's DPAC that are taking the government to court over the £20 uplift because disabled people didn't get the uplift for universal credit, because most disabled people are on ESA and didn't get it. And we were in court last week in the High Court, and the judgment will be out soon. We challenged also the government around their disability strategy because they didn't talk to disabled people in the course of developing a strategy. So you've got a disability strategy that no disabled people were involved in developing. So there's a huge job on our hands. But I've been in discussions with Labour front benchers, and just to give you an example, there was a policy that went to the Women's Conference, Labour Women's Conference, to make social care free at the point of need. And they sent in Debonair to kibosh it. And she went in there and they got rid of it. They said, and their argument was, if we promise social care free at the point of need, the Tory press will have a field day. That's the politics of collaboration. That's what we've got from the Labour front bench at the moment. So that's the job that we need to tackle. So I would call on you to support DPAC, support Reclaiming Our Futures Alliance, have a look at the ROFA website and our vision for the National Independent Living Support Service, and let's join this fight, and let's make sure that we not only defeat this bill, but we defeat all the social care proposals that are the vision of the NHS's future, unless we fight.
Thank you so much, Mark. And some of the figures that you quoted were quite illuminating, weren't they? 90% of social care used to be publicly run, but now 90% is in the private sector. And in matter of fact, when I was a member of the Labour Party, I'm not now, some years ago, I attended a regional meeting with Labour where they were talking about social care. And one of the examples quoted by a Labour Party portfolio holder at County Council, I believe, was that people with disabilities were saving up their benefits that they got to help them live a full and happy life with their disability, and using it to do things like go to Disneyland. And that was put across as the most terrible thing, that somebody should save up money that was meant to go some way to help them live a full life and use it to go on holiday. So, as sad as it is for me to hear that, I absolutely know where you're coming from when you're saying that Labour isn't much better. And actually, the fact that 50% of people who are disabled are young children or working age, and they're expected to pay for their own care. I was involved, in a really small way, trying to get, some awareness raising about young kids here who had money taken away from them for care that wasn't even, meeting their needs. So we have got a lot of work to go there, and thank you for highlighting some of it to us. We're now going over to Christopher Brooks of the National Pensioners Convention, and as I'm sure the other speakers have, Chris is going to provide us with some information that might open our eyes a bit. Thank you, Chris.
Thank you very much, Jo. Yes, and we send our condolences to Jan Short, who's attending her mother's funeral today, and I think she's helped to arrange. Jan lives in the northeast, Newcastle area, and her mother was in London, so it's been a difficult time for her. Anyway, I'd like to say thank you to the speakers so far, because they have really hit the nail. You know, they put things forward. I mean, Polly was saying it's a dangerous bill. Well, certainly it's dangerous for poor people. It's dangerous for disabled people. It's dangerous for really old, frail people. And it's a danger to the carers who are looking after them, and for those who are looking after those people who are not in care homes, in their own homes. So Andy Burnham has got a good take on it. Pity he's not around to actually gen up the Labour Party as such. He's got a more, to him, important overall job in the Manchester area, which is very good. But he's got those beliefs, and they are the beliefs that we should all have. We should be helping each other. We should be collaborating. We should be trying to help each other in our special needs. Special needs are something, I was a school teacher. Special needs was really important towards the end of my career at school, because everyone is special and they all have a need of various kinds. And obviously in health and caring, where they need to depend on society to help them. Society is made up of all of us, 66 million people. We don't have any choice to pay taxes. We have to pay taxes. But there are choices on what these taxes are spent on, and that's the job of the politicians to sort it out, of course. And I'd like to say thank you to Mark for putting forward the idea that Labour is really in it up to their necks, just like the Conservatives are, because really they should be hammering the Conservatives at the moment. They've got ready-made arguments that they can use. It's being pointed out by just about every union there is. And I'd like to say thank you to the trade unions for supporting the pensioners, National Pensioners Convention, because they are the former key workers that helped to make this country great. We call ourselves Great Britain. I'm not so sure that elderly people would consider Great Britain to be as great now as it was then, because it's not championing the disabled and the pensioners as much as it ought to. Anyway, the fight back, push back. Well, if we don't push back, we're simply going to be overtaken by American insurance style stuff and fall into debt, especially the poorer people. Otherwise, they will just suffer greatly, not be able to pay for any of the services that we already at the moment say are free to us. So we in the National Pensioners Convention, we certainly want a system that's a national care service with national standards of care and registration for staff, funded completely from tax that we all have to pay, working alongside the NHS, integrated, yes, but separate in the concepts, working hand in glove, but not to be the poorer of the two, but to work alongside, because the aims are slightly different, aren't they? Can I just say the NPC, it has contacts with all in government in different ways, and it has submitted a report to the Public Bill Committee in the House of Commons. And I just read out some of the stuff that's sent. The National Pensioners Convention is the largest campaigning organisation for older people in the UK. And our founding principles are these: every pensioner has the right to choice, dignity, independence, and security as an integral and valued member of society. Well, I would say it's not just every pensioner, every person has that right. Every handicapped person has that right. So we submitted our comments to the Public Bill Committee on these issues, but changes to policy are often done without taking a holistic view of other events which conspire to undermine equality of access to health and care services, as well as diminishing public accountability. And we've got postcode lottery coming up. It's going to get worse if this bill goes through. And we pointed out all the flaws and omissions and lack of clarities in a number of areas. So I'll just go through one or two of those. It was mentioned that the vast number of CCGs is going to be reduced to just 42 boards. And some of these boards are going to have, by the look, if it gets passed through, commercial interests on them with much less input from the local authorities. Whereas local authorities are expected to do a lot of the assessment and everything as it does. And, you know, they've had their budgets reduced over the years, so they can't actually do the sort of care that they used to do. And why not? Because central government is saying, sorry, you can't have this money. It's next year it's going to reduce, next year it's going to reduce. And so they got out of a lot of the care home provision with the lovely sort of standards of care that they had in them. Okay, they tried to keep on monitoring what was going on in the private sphere, but they themselves had to get out because they simply didn't have the resources for it. They were being defunded by central government because the idea, I suppose, at the time was localism. Oh, localism works. Let's give it all to the local authorities to sort out. But very meanly, they then cut down the budget so that they weren't able to do what they did before. Basically, we think that this bill is completely unnecessary at this time. Why? Because already there are boards, there are people interested, the whole system is being allocated the money and working it. Further reorganization will waste money in itself, and a reduction in the number of boards means that there will be further rationing because they're going to work to a budget given to them, not a budget where they can work out, oh, we need X billion pounds here because of the needs of the people. We've worked out what the needs of the people are. No, you have to fit the people into the budget. So it's not needs assessment, it's budget related. So the fix that the government talks about is purely a financial fixation. And they seem to be fixated on tax, what money they can get back, what money you have to pay. That's what the present government is really thinking about, trying to make it human or humane, but it's not really working, is it? People's real health needs and care needs are not really being met as they should be. Okay, let's see what we've got here. Oh, we've got waiting list targets. Yeah, oh, yes, we know there's a huge mountain of jobs waiting. I think Jonbosco mentioned that, or Mark Harrison mentioned the mountain that's coming over the hill, you know, getting through the pandemic, and then a huge backlog of waiting lists, which probably I should be on myself in one sense. I think the King's Fund found the waiting list for hospital treatment stood at 5.4 million people on the 12th of August 2021. There are no measures in this bill aimed at bringing down waiting lists, not even mentioned, I think. And if this reorganisation goes ahead, it's likely to result in a significant rise. This bill is simply about how money is being allocated and how other organisations can get in on it. Social care, well, we had a result on social care yesterday. Once again, it was all about money rather than about what the carers need, what patients need, how they can get their lower level needs met. That doesn't come into it. The actual lifestyle and quality of life. Everything depends on the key worker at the time. And really, the key workers need a lot more support and help. They need better status. And so there ought to be cross-party long-term planning to help with a better structure and a career path for carers. You know, even colleges for them, a real professional attitude to raise their profile.
Thank you, Chris.
I just want to finish one last thing.
Go on then.
It's about hospital discharge. There must be adequate hospital discharge going on, not to rely on what I think they're saying they can discharge them without a care packaging plan. It will have to be assessed after they discharge. Now that is going to be very dangerous thing to take on board. The final point I want to make is that we're going digital, you know, virtual and digital much more. I mean, how many people are actually able to see their doctor? How many people are able to know what their profile is on the medical records? A lot of people don't even know that they could be sold and transferred, especially with boards coming in. So I'll leave it there. I say thank you very much for the speakers. And I think Mark Harrison and ourselves have quite a lot in common. And he pointed out it's a 50-50 split on the funding between disabled people and pensioners' social care.
Thank you, Christopher. Your contribution, as ever, is much appreciated. I'll just let you know that when I worked for a trade union, Peterborough City Hospital tried to bring in discharge to assess. Exactly as Christopher has said, when they discharge you and then they assess you at home, bearing in mind that if you have to get taken back into that hospital for the same reason within a certain space of time, the hospital doesn't get paid for it. So it was utter nonsense. And the responsibility of the staff who had to go out into people's homes to discharge them. Luckily, at Peterborough, we had a strong fighting trade union and we opposed that, but they were also trying to bring it in and did to a certain degree over the pandemic at the Queen Elizabeth Hospital. So, you know, discharge to assess is coming in. And just on very quickly, Christopher mentioned American health insurance giants. Well, actually, there's already been 500,000 patients who have had their GP services passed over to the hands of a US health insurance giant. Its UK subsidiary, Operose Health, is the largest private supplier of GP surgery services in the UK. And in matter of fact, its former Chief Executive Officer, Samantha Jones, was appointed as an advisor to the Prime Minister on NHS transformation. So we certainly can't trust them as far as we can touch them, really, and we can't trust them then. So I'm really pleased to hand over to our final speaker from what I believe is a real fighting trade union. So welcome, Colenzo, Jarrett-Thorpe, and I look forward to hearing from you.
Thank you very much, Joe. It's can you hear me? It's my privilege and honor to be here to address you this evening, to give you the Unite perspective on what's going on. And it's good to be here with East Anglia Not-for-Profit, because I don't know, some of you might know, I was living in East Anglia. I was living in Norwich for a few months this year, and I was really welcomed by the Norwich community and Norfolk community. So it's really good to hear from people. I'm living back in London now, but you know, Norfolk and Norwich will still always hold a dear place in the hearts of me and my family. So thank you very much for the welcome you gave to my family for those 6 months. But I'm here to talk about health and social care, but as you know, people say what the union's doing. Unite has led the campaign against the Health and Social Care Act with other other trade unions like the BMA, and obviously with health campaigns together, keep our NHS public. Jonbosco with We Own It have done really fantastic work on that. But we've tried to lead it from the trade union side, and we've had a clear policy against the Health and Social Care Bill. We oppose the Health and Social Care Bill. It is the wrong prescription from the NHS. Can I lay that down? I'll say it once again in case you didn't hear me. We oppose the Health and Social Care Bill, not Social Care Bill, Health and Care Bill. It is the wrong prescription for the NHS. It doesn't do anything to overturn 40 years of marketisation and privatisation. Doesn't do anything to stop the outsourcing and contracting. It doesn't do anything to address working times. It doesn't do anything to address the funding in the NHS and 11 years of austerity under this terrible Conservative Liberal Democrat government. Doesn't do anything to make sure the social care system is better, and it's a national care service and independent living service, which is Unite's policy. Unite has a policy for a national care and independent living service. Okay, that was a policy passed by Executive Council back in September. So we're with you on this. We are with you on this. We're behind you this. But it's no good us talking in a bubble here. And that's the problem. We talk in a bubble. We need to be talking to the people who don't know about this. Let's face it, even our members that work in the NHS have got no idea what the Health and Care Bill actually does. Doesn't interest them. Honestly, it does not interest, doesn't address their day-to-day concerns because it's so boring, frankly. I'll tell you my favourite joke. Do you remember sustainability transformation plans, which is the first iteration of what we have, the Health and Care Bill? Well, a few years ago, I went to a hospital. I decided to have my wisdom tooth removed. And I decided to do it in the NHS. So I was sitting there trying to get my wisdom tooth around the time of sustainability transformation plans. And I was with there a load of other people that are waiting for various ailments in what was Queen Mary Hospital in Sidcup. Okay, so I thought, let me start talking to them about STPs. So I was talking about sustainable transformation plans, how there's a lack of accountability. You know, there's faceless bureaucrats that are controlling the NHS. It'll be not under democratic control. Like this bill proposes, local authorities will not have much say in what happens. Who runs the NHS is just faceless bureaucrats. And I'm saying, this is what STPs are going to do. They're going to privatise the NHS in front of your eyes. There'll be private companies, but they'll still have the NHS logo on them. And I kept on talking about STPs and what they were doing. They were all looking at it blankly. And then one of my fellow patients looked round to me, are you talking about STDs? You're in the wrong clinic. So, you know, we've got a real problem because we're not connecting with people, I'm afraid. And we've got to find a way to connect people. We've had 4 general elections where we've said the future of the NHS is on the line. How did people vote? They voted to scupper the future of the NHS. So the government, and even a Labour government to a certain extent, you know, in England, didn't do much regarding that. All right, there's no doubt about it. The Labour government put far more money into the NHS than any Conservative government, the most in the NHS's history. But they didn't remove the tenets of the market, which blight the NHS. Let's compare the Labour government in England compared to the Labour government in Scotland and Wales. We don't have to go far. They've got a far different system in Scotland and Wales than they do in England. And it's not blighted by the market. I was speaking to a member the other day, and she works for now consolidated CCG. Okay, her role is about stakeholder engagement. But she was telling me, how can I tell people about the new system that's going to come in to the NHS through the ICSs when I don't understand it myself? The remarkable thing about this, even the bureaucrats that are going to implement this system don't understand it. It's the blind leading the blind here. And this is when there's record waiting lists. I think Christopher was saying 5 million people. There's not going to be workforce plans. There's 84,000 vacancies of full-time equivalents in the NHS, according to the King's Fund. There's a workforce plan. You can't grow nurses, doctors, biomedical scientists, pharmacists, speech and language therapists on seed. It's going to take many years to overcome those problems. 11 years austerity cannot be wiped out in a couple of years. It's going to take another 5-6 years to wipe out those years of austerity. It's a slow, grinding, awful process that we've got to do, but we've got to start somewhere. So Unite is part of that fight back. Unite does want to see a national care and independent living service. We do want to see the end of this bill. This bill is going to pass. Hopefully we can get the democratic accountability in, but it looks like all the amendments, as Jonbosco was saying, are being defeated, and we have to rely on the Lords. But, you know, we've got to do something about it, and we mustn't give up. We must have hope. We must talk to our friends and colleagues about what's going on. I'm not talking about the same people that go to the same demos and the same meetings, not those people. We've got to speak to people that don't normally know about it, as boring as this topic is, and will make you very unpopular at the dinner table. But maybe in subtle ways we talk about the privatisation of the NHS and under our hands, because two people do cherish it, and telling people what the difference is in their pocket between the NHS system that we have, which is free at the point of entry, free at the point of use, compared to the American system where people are paying 1,500 quid a month for health insurance for a family of 4. That's a big difference, isn't it? Going back to Polly's point, saying that the national insurance contribution, we know how to fund social care. How do you think we fund social care? Tell me, how do you think we fund social care? We fund it from the people that make the most. Tell you another fact. We had the Sunday Times Rich List this year. Guess how much the richest 1,000 people's income rose, wealth rose in between 2020 and 21. Guess how much it rose? Come on. I'm asking you. Do you know how much it rose in that time, in 1 year? The richest 1,000 people in this country, their incomes rose in 1 year between 2020 to 2021. Their wealth rose by 22%. Then people got the temerity to tell me that NHS workers aren't worth an extra 15%. And public sector workers get a pay freeze when their wealth rose by 22%. That's where you tax and get the income for social care. You tax the people with the broader soldiers and the people that made the most out of a pandemic. Loads of people made money. That's where you do it. How can we push back? We need to talk about these policies to people. We need to say, you know, this. You need to tell people, well, the richest people get the most. Talk to people in the pub. Talk to people in the church. Talk to people in your mosque. Talk to people at the social club about these. Educate them. They don't know. As one of the speakers said, Paulo was saying, we don't know. People don't know this stuff. We need to tell them. Write to your MPs. We're in East Anglia. We've just got Clive Lewis, and that's it, as a Labour MP. So most of you, you're living in East Anglia, you should be able to write to a Tory MP and tell them to oppose this bill. Meet them in the surgery. Talk to them about it. Say you're not going to vote for them. You know, that's another way to do it. The other point is to mobilise as well. Talk to people, go on the demonstrations, talk to people to write to letters. And also, some of you, you may want to apply to be board members. We need friendly ICS board members that are going to stop wages and end national collective bargaining. Maybe some of you could be ICS board members. We need friendly board members. If you just let it to the Tories and their mates, we're stuffed. Apply to be a board members. So I'll end, Joe, by saying, you know, we can't just keep the faith. We've got to spread the faith. Get out there and spread the faith and talk to people about this. We cannot be contained in our bubbles and our echo chambers, because, you know, every time I speak to people that agree with me, we need to challenge our space and try and speak to people that don't agree with us, because that's what will happen. And also put pressure on the Labour Party to make sure we have a national care and independent living service, and that is a respectable party. And we tell them, I can understand where the Labour Party are coming from. They are spooked, because if we come up with a policy that will cost loads of money, everyone will say it's unrealistic and we won't be able to pay for it. But we need to show the Labour Party that we can pay for it, and it is affordable and it's not unreasonable. But that takes a lot of work, us telling people about where money's been wasted and who has the wealth in our society. Don't keep this faith, spread this faith, spread the word. Let's go out there and win this for all of us, for an NHS we love and we like to protect. Thank you.
Thank you so much. That was so lively. And when you find yourself sitting there like a nodding dog, you know, you're exactly right. You're talking to people that are already persuaded, but, you know, it was incredibly powerful what you had to say.